Have you ever woken up with an eye that feels gritty, looks red, and seems to be constantly watering or oozing? It is definitely an uncomfortable experience, and it can be especially concerning when it happens to a child. Viral and bacterial pink, also known as conjunctivitis, both cause inflammation of the conjunctiva, the clear membrane covering the white part of your and the inside of your eyelids. While they share some general similarities like redness and irritation, they often present with distinct symptoms that can help differentiate between the two. The key difference in symptoms largely stems from their underlying causes. Viral pink is frequently associated with a common cold or upper respiratory infection, meaning it is often accompanied by cold-like symptoms such as a runny nose, sore throat, or fever. The body's immune response to a virus typically produces a watery discharge. On the other hand, bacterial pink eye is caused by bacteria invading the eye, leading to a more localized and often more intense infection. The body's fight against bacteria often results in a thicker, pus-like discharge. For viral pink, you will typically notice significant tearing and a watery, sometimes stringy discharge from the eye. The redness might appear pinker and can affect one or both eyes, often starting in one and spreading to the other. There can be a feeling of grittiness, sensitivity to light, and swollen eyelids. With bacterial pink, the discharge is usually thick, yellow, or greenish, and can cause the eyelids to stick together, especially after sleeping. The eye redness tends to be more intense, appearing bright red, and it can affect one or both eyes with more prominent itching and burning. You might also notice swollen lymph nodes in front of the ear, particularly with severe cases. Knowing these subtle differences is incredibly helpful because the treatment approaches are entirely different. Viral conjunctivitis usually does not require specific medical treatment and typically resolves on its own, much like a common cold, often within 1 to 2 weeks. The focus is on comfort and hygiene. Bacterial conjunctivitis, however, usually requires antibiotic, eye drops, or ointment prescribed by a doctor to clear the infection and prevent complications. If left untreated, bacterial pink can lead to more serious eye issues, though this is rare. Understanding whether pink is more likely viral or bacterial helps guide the appropriate next steps. While viral cases often just need time and comfort measures, a potential bacterial infection warrants a visit to the doctor for proper diagnosis and treatment. Always remember that good hand hygiene is essential to prevent the spread of both types of pink to others and to prevent reinfection.